better.
Kyle Hoath is the AMA-WA president and he joins us live on 6PR. Good afternoon.
Hey, Ollie, how are you?
I'm all right, Kyle. Is it too little too late or is it a good start?
No, this is a good start. I mean, this is a great start, right? There's $50 million that wasn't there yesterday to bring our sort of struggling ageing hospitals up to scratch. Pretty much exactly what we asked for. And although we know it's not enough to solve the problem in its entirety, I can't help but be happy to see that we're getting some action and attention towards these really important problems.
It's interesting you use the language there of ageing hospitals, which was also used in that press conference today. Last week, they were calling it a world-class health system, which you also asked them to stop using that term. Are there now better lines of communication, do you think, with the government? They have realised, after pressure from the AMA, pressure from the opposition, that something had to give?
I'd like to think so. I mean, and honestly, I'd give credit to your callers and a whole bunch of the community that have spoken up over the last week and shared their stories of what it's like in these hospitals. So not just hearing it from the doctors and nurses and other health workers on the front line, but from the people actually using these hospitals as patients and family members, all sharing the same stories and the same concerns. So, it could have gone one of two ways. The government could have put their head in the sand and ignored it, or they could have decided to spend some money to both fix it up and investigate why it's a problem in the first place, which is what this announcement does. So I have to be happy about that.
Yeah, well, the AMA has been talking about this for some time, obviously, Dr Hoath, and we didn't have that announcement in the state budget, which was only a matter of weeks ago. How urgently do you hope that they address these issues? What sort of a state are these three particular hospitals in at the moment?
Yeah, there looks some urgency, right? Like I said, which is, again, why it's great to hear that they've taken some action and spoken about this now and not at the next election or not when they could have scored more points, but instead taking ownership of this and sorting the problem out. I don't know how quickly that means that these problems get solved, but there are certainly some urgent ones, particularly at Charlie's, and I dare say at those other hospitals as well.
Audit into health maintenance and procurement will also be undertaken by the former Under-Treasurer Michael Barnes and the former Department of Health Director General Neil Fong. How important is that?
Yeah, it's really important actually, and what I hope comes out of this is a bit of oversight, or at least some clarity around the other problems that we haven't spoken about or haven't been able to bring enough attention to, because I'm sure this will uncover more areas that we need to improve the way healthcare is delivered and infrastructure is supported. I imagine that this will involve spending more money, unfortunately, for the government, but at least they're looking at the problem instead of, as you rightly said, going around calling it all world class and a little bit of a head in the sand mentality. This is a much better approach to be taking. What
about the approach of having these multiple health ministers? Because there's John Kerry at the centre of this, is the health infrastructure minister. He's got a lot on his plate, Dr Hoath, because the housing crisis isn't being sorted out anytime quickly either. The hospitals and health are obviously under sustained pressure. Is it too much for one person? I know you've got a few health ministers to deal with these days, John Kerry and Meredith Hammett. Should that just be under the one watch of one person?
Yeah, look, hard for me to comment on this early in the piece. I think that the idea is sound. Health itself is an incredibly challenging portfolio. I think it deserves the support of a number of ministers, and how well they work together, I guess time will tell. So we're keeping a close eye on that one, but a tough one for them, I think.
Kyle Hoath, thanks for your time.
No worries, I'll take care.
That's the AMA-WA President, Dr Kyle Hoath, off the back of that announcement by the state government today, $50 million maintenance program into Charlie's, Armidale, RPH, audit now of the existing program.